All right, our next presenter is Apoorva Limaye, Medical School, Molecular Pharmacology and Therapeutics.
If you show this picture of Tom and Jerry to someone who has never seen the show, they'll assume that it's a show about a blue cat and a brown mouse. And looking at their happy faces, one might also assume that these two are good friends. But those of us who have seen the show know that they're arch enemies. So the problem with a stationary picture is that although it's worth 1,000 words, it's not telling you the whole story. And we face a similar problem when it comes to designing drugs for cancer therapy. See, in cancer, certain enzymes in your body that control the process of cell division are overactivated. So you want to design a drug that will block these overactive enzymes. The conventional method used to design these drugs involves taking a still image of an enzyme, which looks like a tiny bean, and then design a drug molecule that can fit into the enzyme's active site, which is that notch you see over there. And this is how you block an enzyme's activity. Unfortunately, for a lot of enzymes, the images taken using this conventional method end up looking almost identical. So when you use these images as templates to design drug molecules, you end up with a drug that not only targets and blocks the overactive enzyme in cancer cells, but also blocks a bunch of other enzymes that are keeping your healthy cells alive. And this is what causes the horrible side effects that are associated with chemotherapy. So how do we design better cancer drugs? That's what my research is about. See, unlike those stationary pictures, enzymes in your body are continuously moving around. So what I did was I took 2 fluorescent probes, like those glowy stars, and I attached them onto enzyme's surface. Now, as the enzyme moves in a solution, the distance between the probes keeps changing, and this allows me to track the enzyme's motion. And what I observed was that 2 different enzymes, one overexpressed in blood cancer while other in melanoma, although look identical in still pictures, in solution as they move around, assume totally different shapes. And this is the key information we need to design a drug of a particular shape so it can go and bind to the specific enzyme you want to block depending on the type of cancer you're treating. And this is how you can drastically reduce the horrible side effects the chemo patients face. So to the cancer patients out there, the future picture may look bleak now, but with novel approach of drug designing, we will soon have chemotherapy with better patient outcome. Thank you.